would say this, that first of all, I will confirm that we let go Susan Monarez yesterday. I'm not going to talk about personnel issues, but you know, the CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, understands that the CDC has on its website today that among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website, look at it. Fluoridation, giving kids a toxin, and vaccines. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency.
The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you?
There's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer. Description of how rural areas, particularly in Texas, provide the food, the fiber, the energy.
There's so much going on right now when you look at the devastation that's happening to our staff, our campus, the programs. We won't forget you. We're just now going to really advocate for the great work you all do. We love you all. I'm already missing you guys, but I just can't tell you like what CDC means to all of us, the mission, the work, your commitment. Thank you. We're so honored.
We didn't really expect this.
I know.
but thank you so much for being here. You know, what makes CDC great are the people that make CDC up, the scientists, everyone that makes this a family, and it's a family that defends our country and the health of our children and the health of adults, whether it's because of vaccines, whether it's preventing overdose, chronic disease, stopping Ebola at its source rather than letting it come to this continent. You are the people that protect America, and America needs to see that you are the people that protect America, and we are going to be your loudest advocates.
And what makes us great at CDC is following the science. And so let's get the politics out of public health. Let's get back to the objectivity and let the science lead us, because that's how we get to the best decisions for public health. So thank you all very much. This is an incredible showing. I really appreciate you, and we will be having your back from now on.
Yes.
Thanks a lot.
We need Congress to intervene. We need our appropriations. We need to follow science. We need to have ethics back. All of these scientists, like Dimitri and Dan said, are doing the work on the ground. We need to be able to do it without interference and following data and science.
The other thing, though, was when we looked at vaccines, and that was probably what really brought it to the forefront for me and for all of us. The ACIP is coming up, and all of us are driven by science and data, and we stand by that. We became aware by conversations with work groups that many of them were deciding on what recommendations would be before actually having the data. And for us, that's problematic. As scientists, you should never know in advance what you want the data to show. When Susan came on board, we were delighted to have scientific leadership at the agency. I think we all had a sigh of relief, like, I can do this, I can stay. After 4 or 5 days, she tried to change the ACIP, including adding a new designated federal official and having all of the documents posted for public comment. She wanted to have engagement and transparency. Those things were not done. She was given feedback from HHS that those couldn't happen, and she was called to a meeting with the secretary on Monday. For us, we knew that if our scientific leader couldn't make changes like that, we could no longer stay. And we talked about it together that for us, this was a together thing. We were going to do this together.
I could not, in good conscience, continue my work and promising the American people, as I swore when I took the job, to make sure that we were providing the highest quality data to preserve their health and well-being. Attached to that, I'm a doctor. I took the Hippocratic Oath. I said, first, do no harm. I believe harm is going to happen, and so I can't be a part of it.
Thank you very much.
Thank you.
Build up the immunity for this vaccine.
And I kind of wondered if that's I know, I'm sorry, and we're done.
Fussing for no reason.
You did a great job.
What do you think? You want some candy? What do you say?
Just over the last few months, it really has been a different approach to things. I think we were asked to host a number of individuals that were brought in specifically to review and revise the scientific information that we had thought was settled, information about vaccines and vaccine safety. And so in my center, we oversee the vaccine safety group. And as we were being asked to revise and review those kinds of things, I had to keep asking them, what is legal here? What is scientifically sound? What is ethically responsible? And what I was told was that the requests were legally supported and that was enough. But for me, that's just not enough. And so for me, I have come to that point where I'm not able to fulfill the duties that I have as a public health professional in this environment at present.
I have to do a presentation here in a few minutes. What we believe is this is not political.
Yep.
It's about ideology. We have worked in many different administrations, including the prior Trump administration, very successfully, and briefed the secretary and the assistant secretary regularly. We saw our programs thrive. So this is not politics, this is ideology.
Yeah.